Hi, this is Dr. Andy Wen-Chih Liu of Kaohsiung Medical University Hospital in Taiwan. I'm speaking to you about our JBJS article, MRI assessment of median nerve size in patients with proximate electrodiagnostic studies. This study I complete together with my colleagues and mentors at Massachusetts General Hospital. Carpal tunnel syndrome, or CTS, is the most common nerve entrapment condition we see in clinical practice. Traditionally, we rely on clinical symptoms, physical examination, and electrodiagnostic studies to confirm the diagnosis and to grade disease severity. In recent years, ultrasound has become increasingly popular, especially it allows us to measure the size of median nerve. However, ultrasound measurement can be highly operator dependent. So in this study, we asked a simple question. If we use MRI with a standardized measurement protocol, does median nerve cross-sectional area, or CSA, can actually perform well as a diagnosis marker for CTS? What we found was surprising. Even with MRI and even with standardized measurements, median nerve CSA showed only poor to fair diagnostic performance. The carpal tunnel index was best performing level. At this level, a cutoff value of 11.3 square millimeters produced an area under curve of only 0.67. The sensitivity was 74% and the specificity was 60%. In other words, CSA alone was not strong enough to reliably distinguish patients with electrodiagnostically confirmed CTS from those without it. These findings suggest we should be cautious about using a single CSA number to diagnose CTS, especially when the clinical presentation is uncertain. To be clear, we are not saying that ultrasound or MRI have no rule. Instead, we believe imaging is the most valuable when it helps us evaluate nerves, longitudinal caliper profile, or alternative pathology that may explain the patient's symptoms. This is where imaging can truly add clinical value. For the full methodology, result, and discussion, please refer to the full article on the JBJ's website. We would sincerely appreciate your comments and feedback. Thank you for watching.